We distribute our products through healthcare professionals and also, companies who really work with a lot of healthcare professionals like Nutrition. My name is Dennis Schoen. I'm the founder and CEO of Research Nutritionals, and we're a company that started 18 years ago. Our focus as a company and the genesis for the company was actually to do something and build a company based on clinical research that would get published in peer-reviewed journals. Our thought was we can raise the bar in this industry and not have white papers and marketing sell a product, but let the research and the information sharing sell the product, because that's how the patient's going to really benefit. I think two things that really make us different. One is the clinical research that's peer-reviewed published. That's number one. And we do a lot of that. We do it at major universities like Penn State University. We have another study underway at Northwestern University. We work with research institutes in different countries, but that clinical research and getting it published, having it on PubMed, that's who we are as a company. You shouldn't have to guess what your patient's going to get. You should know because the research proves what's going to happen. The second thing that's very different is our concept in product development. We don't develop products because of a fad ingredient. We develop products based on a concept. So if you look at our mitochondrial product, most mitochondrial products are working on the Krebs cycle. But you could put 1 gram or 2 grams of CoQ10 in a patient and see no benefit. You need to understand why they're fatigued. The primary reason patients are fatigued is because of the runaway inflammation and oxidative stress in their bodies. What's causing that, or what's the damage doing to it? It's damaging the mitochondrial membranes. The mitochondrial membrane is where the electron transport chain is housed. That's where ATP is produced. The membrane doesn't work, well, guess what? ATP doesn't get produced either. So our focus is how to repair those mitochondrial membranes so we can make patients feel better. How do we reduce that inflammation within the mitochondria? And so we have a product, our ATP 360, which actually addresses this very nicely. And it showed a 19% reduction in inflammation within 60 days, a 52% improvement in energy. Because so many of the mitochondria in the brain, we had a 30+% improvement in mental functioning. So that's the type of work we put into product development, and then we do the clinical research to prove the efficacy of the products. We continue looking at what's causing it. So for example, we have a product for biofilms. So people often say, okay, we have to do something about bacteria, whether it, regardless of what the bacteria is that's in the body, what the virus is in the body. Our approach is, again, how do you address that? It's not just going after the bacteria, but it's also going after what's stopping the immune system from recognizing it. So we develop a product, and we developed it to go after specific biofilms. Then we do the peer-reviewed research, and we can show the benefit of reducing metabolic activity and mass of the biofilm. So now, whether you're using antibiotic therapy, herbal therapy, or anything else, you put that with this anti-biofilm product, and you're going to get much better results. So we do research on that. We do new product development in more esoteric areas that are really key to help people feel better.